Hello, and welcome to Science on the Seventh live stream, a virtual space where we talk about issues related to air quality and health. I'm your host, Pallavi Pant. We are approaching the time of the year now where, for many countries, this is when some of the really high air pollution levels start to go down. Winter is almost at an end. And the issue begins to fade a little bit in people's minds. And we start to think about other things until the next cycle for those high pollution season for that high pollution season comes around. But what is important is that air pollution levels may be going down, but they're not going away. We still continue to breathe higher levels than we should be breathing in. And we need to continuously be thinking about solutions that will help us reduce that air pollution, make the air cleaner. A few months ago, World Bank produced a really interesting, really comprehensive report that looks at exactly those solutions, focusing on the Indo-Gangetic Plains and the Himalayan foothills in South Asia. And today, I'm really excited to be welcoming two of the editors and lead authors for that report, who helped put it together and worked with a really big crew of authors, including myself, to come out with these sectoral interventions on how do we really clean up the air and what will it take to get there. So I'm very pleased to welcome, first and foremost, Marion Cros, who is a senior health specialist at the World Bank. She is based in India, in New Delhi, and for over 20 years, she's been working in health systems financing, and she thinks about a variety of issues, including healthcare, public financial management, nutrition, and for us, what is most critical, the intersection of climate pollution and health. Really warm welcome to you, Marion. We also have Ashley Popley joining us from Washington, D.C., here in the US. She's an economist also at the World Bank, and she works with South Asian governments to design practical solutions to reduce air pollution, to adapt to climate change. And both of them were the lead authors for this report that we're going to be talking about today. So, welcome both. Really excited that you could join us.
Thanks so much. It's great to be here.
Same. Very delighted to be here.
Yeah, and since we are sort of, you're both joining from very different places, so I want to start with a really simple question, particularly Marion, because you're joining from Delhi. What is the air quality where you are right now?
Where I was just checking actually, before this call, and very interestingly, the AQI is quite good. It's actually 60, and I was looking at what's the level of PM 2.5, particulate matter 2.5, and it's actually 15 microgram, per cubic meter. So it's not bad. It's actually quite good. We are in the yellow today. So because I think it's just rained in Delhi. So very nice weather today.
And here in DC, it's the air quality index is 29, PM 2.5 fine particulate matter is below 5, so below the WHO target, which is not always the case either. It does tend to peak in summertime. So yeah, very happy to be breathing in clean air today.
I'm glad to hear that. And also, Marion, it's great that Delhi is a little bit better because I'm planning to be there in a week's time and looking forward to seeing you. So
you getting ready.
Fantastic. So both of you were involved in this, what I would call like a really huge project to put out this publication. I think we can pull up just the title page. It's called Breath of Change: Solutions for Cleaner Air in the Indo-Gangetic Plains and Himalayan Foothills. Can you talk to us a little bit about what this publication covers and what it is trying to do? Ashley, maybe?
Yeah, so this report is a World Bank report that we released in December last year, tackling one of the biggest health crises in the world, which is air pollution in the Indo-Gangetic Plains and Himalayan foothills region, which spans across different countries, including Bhutan, Bangladesh, India, and Pakistan. Now, we know that the scale of the problem is really staggering. Nearly 1 billion people are exposed every day, which reduces life expectancies up to 3 years and costs the economies more than an equivalent of about 10% of GDP per year. But this report isn't about diagnosing the problem, as it's fairly evident in the skies that we see today, but rather it's a solutions handbook which lays out what are the best evidence that we have on how to address and reduce air pollution and protect those who are most vulnerable through the health and education sectors. One of the key messages from the report is that no single country can actually address this alone. So in many of the jurisdictions, including cities and countries, we kind of define it more broadly, more than half of the air pollution comes from across the border, which means that even if you were to target all the money in the world to your single local sources, you wouldn't be able to produce cleaner air. And instead, what the book lays out is that the region as a whole should be working towards a target which aligns with the WHO interim target of 35 micrograms per cubic meter by 2035, what we kind of call 35 by 35. And finally, I just wanted to highlight that the process of creating this book was really interesting. We collaborated with 10 different World Bank departments, as well as external researchers like yourself and others from IIT Kanpur and Wageningen University. And we just wanted to also give a shout out to our sponsors, the UK Foreign Commonwealth and Development Office and the Swiss Agency for Development and Cooperation for generously financing this important research.
Yeah, amazing. Thank you so much, Ashley. Marion, I'm curious also from your point of view, like it's a huge endeavor and thinking about solutions, trying to bring forth, here's the 5 things we need to do across every different sector. What really motivated it? Was it really the huge health impacts, or were there other considerations that you took into account in developing this handbook?
Yeah, no, I mean, thanks for this question. I mean, I think another motivation behind, the narrative of this book, and again, to kind of complement what Ashley has said, is that, I mean, clearly we know air pollution is clearly a health crisis, but I think as well, it's kind of it's an economic crisis. And Ashley, you said it well. I mean, it does actually erode, human capital from children's learning, even health outcomes. You talked about it, Ashley, to workers' productivity. But something sometimes we don't talk enough about is the positive flip side of it. It can be as well an economic opportunity. And that was interesting as well, actually, what we highlighted in the book is that in India alone, meeting these clean air targets will require actually an additional 2 million jobs created. So I think this is important as well to highlight that there is, a good economy stories behind the narrative of the book, and as well, it aligns directly with World Bank Group's priorities, which are about to scale up jobs. Just to mention that as well.
Yeah, I think that's such an important point, because I also feel like, often when we talk of air pollution, even within the community, we tend to focus so much on here's the impacts and look at how huge they are. But when countries and, policymakers in particular are thinking about how to create opportunity, I think that's an angle we don't talk about very much. So I'm glad you highlighted it. 2 million jobs is not nothing at a time when, there are so many people who are looking for employment and gainful employment. So hopefully we'll come back to that a little bit. But, South Asia and the Indo-Gangetic Plains, more specifically, it's also a very interesting place just because of the source mix. It's so unique, it's so complex at the same time. And Ashley, I'm curious if you can talk us a little bit through what the source mix looks like, and how and what kind of tools and methods you use to come up with some of the results included in the handbook.
Thanks, Pallavi. Yeah, so as you said, it's not one single source, which makes the problem really complex to address. So we collaborated with an institute called IASA to do a bunch of modeling using their model called the GAINS model to identify what are the major sources in each of the countries in which we're working. And then we kind of aggregated it up in this book to produce a regional perspective. And what we find is that there are 5 main sources of air pollution. Household cooking is the single largest contributor at about a third of all air pollution, around 32%. Followed by industry at around 21%, transport at about 17%, agriculture at 12%, and waste is a smaller contribution, around 2%. But what is an important policy message is that there's no single sector that dominates anywhere. And so the mix differs a little by country. And so what we need to do is tailor the solutions accordingly. I think the other striking finding that I mentioned earlier that I just want to highlight again is the extent of the transboundary flows, whether it's flows of boundaries into cities from rural areas or across countries. So for example, in the Nepal's Terai region, about 70% of pollution originates from elsewhere. And so that really emphasizes this need for regional cooperation across countries.
Yeah, I think, I mean, also some of these issues tend to intersect so much across how policies are being made in different countries. But in terms of, the major sectors you're talking about, what are the types of interventions that are being proposed in this handbook? I think we also have an excerpt from one of the infographics that we can pull up, but it would be great if you can talk us through, big picture, what are the interventions that would be most beneficial, say for cooking or for waste or for transport?
Yeah, so the book really tries to outline these kind of concrete and even real world examples that we can learn from, because I think the main message here is that solutions exist already. And the question now is about how do we scale them? So let me give you an example rather than like listing what are the most important ones. So for example, on clean cooking, which is arguably one of the harder problems to resolve, in Bihar, there's this example where they leverage women entrepreneurship networks, which train women to become the last mile distributors of, say, improved cook stoves, which addresses both the supply chain issue of like, how do we actually get this technology out to the last mile distribution points, and promoting women empowerment, who are most affected typically by both indoor and ambient air pollution arising from household cooking. On waste, for example, in Chennai, they've got a fantastic program that has an integrated solid waste management program. But what we've learned from decades of work on that is that cities must first build the basics in waste, such as waste collection, segregation, recycling, before maybe more sophisticated interventions, which are highly promising, like waste to energy plants. Perhaps the last example I'll give is from transport, because again, this requires a multi-pronged approach to be able to address air pollution. So in cities like Peshawar and Delhi, vehicle scrappage programs have been trying to retire and get heavily polluting vehicles off the roads. Mm-hmm. But unless you pair this with EV charging networks and standards for new vehicles, you'll just end up replacing these old polluting vehicles with new polluting. So it's really these multi-pronged policy approaches that are needed.
Yeah, no, I think that's interesting, and also what I personally really appreciate from this handbook, and I guess I speak with a little bit of bias, having been involved in it, is the inclusion of really good examples of what has been done and has worked in specific sectors, and the ability to then take those examples and see how they might apply in another location, in another context. It actually makes it useful not just in this region, but in other places that may be struggling with or thinking about similar sectors and what interventions work best. The other piece, which I thought was also very interesting in the framing for this report, was this inclusion of what were called adaptation sectors, which included health and education. And Marion, I would love it if you could talk a little bit about what we mean by adaptation sectors, and then what are some of the ways that the report tries to think about interventions in those sectors.
Sure, no, with pleasure. So it's true, in the book we talk about adaptive sector or protective sector as well, Valerie. So we talk about protective sector to really describe sectors, which are not at the sources of air pollution emission, right? But more sector which I would say help, people kind of manage their exposure, right, from air pollution. So think about health, for example, when you have public health campaign on wearing mask, or education, you have green space, at school, for example, to reduce exposure of kids, right, being exposed to air pollution. Or you could think even about social protection or safety net, at community level, distributing masks, right, face masks during high peak. So these are all these kind of sectors, not unlike mitigation sector, which help reducing air pollution at the sources. Here, really, protective sector help people, and in particular, when I say people, vulnerable population, right? People with comorbidities, children, pregnant women, the elder, to really manage their exposure. And I think, Pallavi, this is critical in the Indo-Gangetic Plain, Himalayan foothills region. Bear with us, right? It's kind of a big region, the IGP-HF region. Because we know that the health impact are huge. It's staggering, right? We said it earlier, it's a public health crisis. 1/3 of neonatal deaths, just to take a few figures, are connected to air pollution. And we know that as well from the data we have, that, 2/3 of kind of chronic pulmonary respiratory disease death are attributed as well to air pollution. So, in this context, those protective sector can really build the resilience of people and make sure that they enter the workforce, but as well remain workforce in good health, because they wear masks, for example, because at the work, where they work, they have ventilation or air purifying system, like I have, I'm a lucky privileged one. So I think that's important. We can as well, just to take an example, and as you know, I'm passionate about health, so I would love to talk a little bit about, what the health sector has to offer, what policymakers, can do to really kind of, protect people from the negative effect of air pollution on the short term, while mitigation sector like transport, clean cooking, what Ashley was talking about, can do on the long term to reduce air pollution, the PM 2.5 level. So in the health sector, I would say there are, like 3 main interventions. The first one is, primary prevention, meaning stopping disease before it even starts. That means making sure at policy level, government embed system assessment, so health assessment of these mitigation measures, transport, energy, agriculture, and that they measure that these interventions, whether they have a positive health impact over time, whether they lead to fewer hospitalization, whether they lead to fewer outpatient visits, fewer emergency visits at hospital level, because of all these mitigation interventions which are set to reduce the level of PM 2.5. And that sounds obvious, but sometimes this is forgotten. We talk about reducing, the level of PM 2.5, but what not about the impact it has, on people's health. So that's important to really, focus on primary prevention. Another set of intervention, we talked about in the book is secondary prevention. And I think that's kind of obvious, in the health sector. So it's making sure, okay, air pollution is here. We know you are exposed, but let's try to limit harm it does on your health, right? Like me, for example, in Delhi, or for my kids, right? So it's public health campaign telling you, wear your mask when you have a high peak of air pollution. It's air purifiers, because we know it actually helps, improving lung function, right? When you have a peak of air pollution. And we know, by the way, mask is cost effective as well. Or it can be as well early warning system. There is a high peak of air pollution. Boom, I get a health alert, which is telling me, okay, wear your mask or whatever. And we know that this early warning system, so in countries which actually have a high level of PM 2.5, have helped reducing the number of particular heart attack. And the last piece I want to highlight from the health sector side, which I think is critical, is having air pollution integrated in the health system, not as a vertical program, but very much integrated in the health function of the country, being public or private, by the way. So making sure air pollution is considered as a risk factor, in standard treatment guidelines that doctors or nurses apply, or in non-communicable disease strategy, or in maternal and child health program, making sure it's part of the surveillance system, making sure it's part of the hospital preparedness plan, making sure as well the workforce is trained accordingly. And again, to come back on the job lens, because again, as you know, it's a key priority for the World Bank. There is a huge, I would say, job opportunity, and I think training people, whether environmental health specialists or data analysts or community health workers, right, doing social behavior change communication to wear your mask, I think will really help building the workforce the region needs, basically, to manage the air quality related issues.
Yeah, so I think, this is all like really interesting, but also I love this framing of what we really need is long-term reduction of emissions through the mitigation sectors. But in the meantime, to make sure that we are reducing exposures as much as possible, especially for those that are the most vulnerable. And I think one really striking graphic, if we can pull it up, there's a graphic about academic, air pollution and then school attendance. And often it's not a surprising, headline. We see often, schools closed because of high air pollution levels, and this is true across Indo-Gangetic Plain. So this happens in Pakistan, this happens in India, perhaps also happening in Bangladesh. But very interesting to see that there is a significant number of school closures triggered by high levels of air pollution. What this means is, kids are staying at home. And I know that the Solutions Handbook also talks about the impact that air pollution can have on academic performance and school attendance. Can you tell us a little bit more about this? Because I don't think we spend enough time talking about this issue.
Yeah, no, absolutely, you're right, Pallavi. And here, I really rely on the fabulous work that my colleagues from the education team, Monica, has done, and that's the education chapter of the book. But clearly, the effect of air pollution is staggering as well on education learning. And I was reading again the figures. 8 in 10 students are actually exposed to hazardous level of air pollution, right, beyond 35 micrograms per meter cubic meter. So this is huge. And in absolute terms, it's, I think, 25 million students in Bangladesh. In India, obviously, it's 200 million students. So yeah, it's huge. And it's not so much the exposure, but as well, it's the impact on the learning outcome. And again, here, I want to quote one of the studies that my education colleagues did, Saher in Pakistan. She actually found that a small amount of, increase in PM 2.5 can be linked to lower test score in Urdu and mathematics. So clearly, there is an impact. You have evidence globally, but you have as well evidence very much in the region. And then I think from the education sector, I think it's important as well to note that there are three types of interventions, basically, a bit like in health. So number one is, what can the education sector do? So number one, it's kind of improving indoor air quality in classrooms, through air purifiers, better ventilation and green space. And sometimes when, countries in kind of limited fiscal space cannot do so, having this infrastructure, there are alternatives, like, for example, emergency plans, for example, shifting to remote learning so that at least you can preserve learning outcomes and you can reduce the exposure, right, of students. And that's, for example, what Delhi is doing with the BRAP plan, Another possibility, the second type of intervention in education is kind of integrating clean air into the education curriculum, basically. In schools, it's updating the curricula, the teacher training. At community level, very interestingly, is program helping building the public demand, right, for clean air, so that then it drive the behavior change, right, to wear your mask, for example. And the third aspect is really trying to build the skills to actually implement those clean air programs. by equipping both, new but as well existing workforce through vocational training, universities, with, I would say, the practical knowledge that country needs to kind of implement solutions on air quality management on the ground.
Those are, yeah, I think, and some of those are really practical things that don't always require a ton of resources or investment either. We can begin by doing those and then along the way sort of, build up the momentum and the infrastructure and the processes for more large scale interventions. But I think the other interesting piece in this report and in the region that you're thinking about is that it cuts across countries. And this is a region which is very close to my heart because I come from the Himalayan foothills. So I know also the importance of cross-sector and regional cooperation, but I also recognize, it's an interesting geopolitical area too. But Ashley, I think one of the messages from the report is that we need regional cooperation. We won't be able to make the progress we want, like the 35 by 35 target, unless there is regional cooperation. So can you tell us a little bit more about how this might be operationalized practically?
That's right. And the good news is countries are already meeting annually to discuss how to best address air pollution and what has been labeled as the science policy finance dialogues. And there's been a couple of agreements coming out of those meetups. The three ways forward are, as identified by the books, are as following. So first, getting countries to align on targets and monitoring is the first step. And this doesn't have to happen, at a regional level. This can happen just at a country level, but making sure that it's moving in the same direction. And so if countries can mobilize around the shared 35 by 35 target and then harmonize their standards and build kind of common emissions inventories, that would then help us monitor how track progress over time in terms of reaching this common goal, which is seen as an interim target, but a very good first step. The second, which is perhaps a little bit more ambitious, is trying to think about how can we institutionalize or kind of scale up this regional cooperation, and whether that's through, for example, a more structured body with thematic working groups, and then bringing in broader participation from NGOs and particularly from the private sector. And there are some good examples around the world that we can learn from. So this is not something that's new. And then third is aligning kind of implementation and mobilizing finance in support of this broader goal. And this means prioritizing and then synchronizing which sectors we're targeting first, the most polluting sectors to begin with, and then mobilize, for example, donor support and private sector in particular towards this longer term vision. And so I think by signaling what the direction of travel is already quite a powerful first step in terms of coordinating and moving all actors in the right direction.
Yeah, and I think I will say, like, thanks to World Bank and also ICIMOD, which has been trying to bring these science policy finance dialogues together, and hopefully this work is gonna continue and we can see more cooperation in the longer term. I know we're getting close to our time here, but Marion, especially for you, I feel like this is a personal issue probably because you live in Delhi, you have family in northern India, which is part of the Indo-Gangetic Plains, and people tend to experience high levels of air pollution. I'm sure your kids are experiencing it, and you and other family are experiencing it. So how does that personal experience really factor into some of the work that you're doing and the approach you're taking in doing this work?
Sure. No, I mean, for sure, it's very personal. I mean, for me, and I'm sure for other as well people living here. I mean, I guess, yeah, and I have extended family as well in Eastern UP, where it's quite polluted during winter months. Well, how we adapt. I mean, I guess during the high peak season, as we say, in particular in winter, we try to wear face masks for activities. I think we are very privileged in that, for example, my kids go to a school which has a very good air purifying system, right? Ventilation system. Sometimes as well, when it's really bad in November after Diwali, we go for a weekend, for example, in the mountains because we know the AQI will be a bit lower. So we are super privileged, I have to say. But I think, what drives my work is really based on what I see around me, it's very interesting to see that despite the high level of air pollution, you still see a lot of people in Delhi and in the surrounding area who do not wear masks. And even, the other day I was with my kids at a soccer game, and I could hear people saying, oh yeah, air pollution is a bit bad, but it's okay. They just need to get used to it, they will become more resilient. So it's interesting. There is kind of a skepticism about the health impact of air pollution, and those people were educated, right? So I think the communication simply, has not been strong enough. There has been communication, but it's not strong enough. Perhaps it needs to be more targeted to the vulnerable population, but to certain population as well. And it's interesting because I think COVID showed us a lot of good lessons learned in terms of social behavior change communication, right? I mean, everyone was wearing a mask here, right? But interestingly, we have lost this energy for air pollution. So, and we know the evidence is clear, right? Wearing masks will save lives. It will actually, on the short term, decrease your exposure and really save lives. So I think, that we can do better. And I think that's what, drives my work and my appetite, in this area.
No, I think that, that's great. And I think also we definitely need more on the communication. But my final question, as we come to a close for this discussion, is maybe more personal. So both of you are coming from very different disciplines and trainings and backgrounds, and air quality is probably one point of convergence for both of you. And I would just love to hear your thoughts and perspective on, how and what the experience has been working on the issue of air pollution, and what, if anything, is giving you hope for that cleaner air and that clean air future that we're all working towards. Ashley, maybe I'll go to you first and then come to Marion.
Yeah, so as an economist, I think what I love about working on this issue is how truly interdisciplinary it is. You need to have atmospheric scientists, agronomists, transport engineers, governance experts, economists like myself around the table to be able to work on these solutions. And that's what this book aims to do. And that's what our work on the ground aims to do. And I think what gives me hope is that the economics are increasingly on the right side. Cleaner solutions for cleaner air are often better economics-wise than the polluting ones. So we see this in the fact that governments around the world are already sitting down together trying to figure out what we can do about this. And the solutions exist, but really the question now is, how do we scale it at the scale it needs to achieve?
Marion?
Yeah. Should I say a few words? Yeah, no, I mean, I think, Pallavi, I still have a lot of hope. I think a lot of positive development really are happening in the Indo-Gangetic Plain region. I mean, for example, health authorities in the Indo-Gangetic Plain and Himalaya foothill really are taking actually more systematic actions, I mean, recently they have been putting in place this air pollution-related illness surveillance system, allowing in a routine way to measure the effect of PM 2.5 on, human health, through using hospitalization as a proxy. So I think many things are happening, and actually I really want, to recognize the effort for that. And I think an exciting next step for me is to see this real-time dashboard whereby you will have, the health effect. You can measure the health effect of all these mitigation measures. We are talking in the books, transport, clean air, cooking, clean cooking, agriculture. How many hospitalizations will it prevent, right, when it is implemented? So if we have this, real-time dashboard, I think it will be amazing. And I know the authorities are working toward that. So that's, I think, super exciting. And second, I'm very hopeful as well, because I see a growing recognition of of air pollution being considered as a risk factor, basically. I think doctors really see air pollution as a risk multiplier for a wide range of health outcomes. And they are really beginning to make that connection more explicitly with their patients. And for example, in Delhi now, you have chest clinics. I mean, it has just been set up in some hotspot area, and that's great to see, right? And the last point is, again, I think it's important to mention that several, Indo-Gangetic plains are actually already building the air quality management workforce capacity, through education and training. And for example, the India National Knowledge Network, I believe, has identified about 40 or 42 types of jobs which will be needed, to kind of implement this air quality management program. So I think, again, framing, clean air action as an economic opportunity is super critical, and I think is a great reason for hope. So that's how I would end,
No, that's an excellent that's an excellent sort of rejoinder on that sort of air pollution, and actually addressing air pollution being an economic opportunity as well as an opportunity to improve the quality of life, health, and well-being of all people. And what I'm sort of taking away from this conversation is that we definitely need those interventions in the mitigation sectors like transport, cooking, waste, agriculture, that will reduce those baseline levels of air pollution. But while we get there, we should also be thinking about what we can do in the shorter term to try and reduce people's exposures, especially those that are the most vulnerable. And I'm hoping more people are going to read this report and use it in the work that they're doing. And thank you so very much for your time today and for the excellent work that you put in producing this book, and hopefully we can continue working together in operationalizing now some of what has been identified as solutions. And Marion, really looking forward to seeing you next week. But thank you both. Really appreciate taking the time.
Thank you. This is a great conversation.
Thank you so much, Valerie. It was amazing. Thank you.
Thank you both. And everyone listening in, we're going to be back next month on May 7th with Dr. Beatriz Cardenas, and we will talk about air quality in Latin America and Mexico. So please join us then. And until then, take care, stay safe. We'll see you soon. Bye.
Thank you.